currently, everybody's saying that the number of deaths and the number of cases of COVID-19 in this country are actually going down. Even though the numbers are large when we put the totals together, everyone keeps on saying it's going down. My question to you is, are you worried about another surge of the coronavirus here in the United States? And are we really doing this good right now?
So first time ever, I'm happy since the pandemic started to say that we are doing very good. Past week, our average number of cases are around 20,000 per day. Number of deaths were close to 400 per day. Those are all tremendously very, very down from where we were in January this year. So the good news is there already. We are almost there, but not there yet.
Right. And just talking about that, Dr. Tushar Patel, last year, around the summertime, things got better in terms of cases and deaths, very similar to what's happening right now. However, when fall arrived, we saw a spike in cases and deaths, and there was another surge that we gone through. So are you a little afraid that that could repeat itself this year?
Always there is a chance with this pandemic. However, the good news is there are more than 85% Americans over 65 and older who are at the vulnerable risk, are at least received one COVID shot, and nearly 74% for the same group are fully vaccinated. So I don't see what we saw last year happening in the US at least.
Wow, that's a very, very, very good news. And just talking about vaccine, I have to ask you, right now many are saying that there is a slow process happening with the vaccine rollout. It's slowing down a little bit. There are a lot of areas where there are a lot of anti-vaxxers and they're just not reaching to them. How are you looking at the entire program, and how important is it for us to get these anti-vaxxers vaccinated?
So right now, 40% of our population in the US are fully vaccinated, about 50% at least one dose. So the challenge begins now, how to get those people who are say no to the vaccine all the time. It's a very difficult situation for this country. We need to ensure that those people who need the vaccine get the vaccine now, and then get the second group, the vaccinaires, so to get the vaccine. It's a very challenging situation right now. We must reach that 60-65% of US population getting the vaccination. If not, it's going to be a little problem.
Right, and when you're looking at these vaccines, Dr. Patel, we're also hearing that a lot of low-income communities and also communities of color are disproportionately impacted by these vaccines. What information do you have about it? And, what kind of solution do we need to reach these kind of communities to get them vaccinated?
So the solution for this population, the minorities, the Asians, the African Americans, the Hispanic population, or the people who don't have a transportation, I think we need to have the vaccination drive in their local area, and somehow we need to provide them the transportation to get them vaccinated. I think if we reach those 10% of the population, we definitely will reach our goal. But right now, those are the people we need to ensure that we have vaccination drives for them. Even in the schools and colleges and universities, we should have some kind of vaccination drives so we can get those individuals who are reluctant to take the vaccine or go to the vaccine site.
Right, and just more talking about vaccine, doctor, there is this big news that's been going around in which we're hoping that we could achieve herd immunity by July 4th. My question to you is that possible? And what does that mean for then this country if we do reach herd immunity?
By July 4th, getting the herd immunity is, in my calculation, is not possible. We need to reach that 20% population to get the vaccine. And between now and July 4th, less than a month to go. It's going to be a very, very challenging unless we do some hard approach, taking some active, very, very aggressive approach to get those individuals in the minority population, the college kids, and individuals between 12 and 15 who just got the vaccine approved. So I think it's going to be very challenging between now and July 4th. My calculation is by end of summer, we should reach that 70% goal.
But do you think on July 4th we'll be able to do celebrations? And if so, how big do you recommend them to be?
July 4th celebration is going to be very dicey. It depending on what happens between now and July 4th. The way we are going, we are stuck at 40% people getting fully vaccinated. If we bump that 20%, which is highly unlikely, it's going to be very challenging to have mass gatherings. Outdoor gatherings are still okay, but at this point, we don't know which population is vaccinated and which are not. So it's going to be very challenging for this country to discriminate those individuals and have them maskless in the events.
What's your recommendation for people that have been vaccinated but are kind of scared to take their mask off outside? Because as you know, you cannot tell who is vaccinated or not.
For outdoor, I would strongly recommend everyone there is no requirement of mask. For the indoor, since we don't know if you go to the restaurant, if you go to the colleges, if you go to the stadium, indoor stadiums or the indoor venue places, we don't know who are vaccinated and who are not. In that case, I would recommend to put the mask on to at least for next few weeks to see how that goes.
Right, that's a really good piece of advice. Just talking more about vaccines, Dr. Patel, we're looking at the fact that today Moderna has applied for a full FDA approval. Both Moderna, Pfizer, and Johnson & Johnson have the emergency FDA approval right now. But what is the importance of getting this full approval, and do you think Pfizer will follow?
So Pfizer and J&J, all three will follow each other definitely. And I think when you apply and when you have the approval, FDA approval for the vaccination in this country, that means you can enforce the rules of vaccinating. So the employer can tell their employee that you must provide the proof of vaccine. The hospital employees, the employer can ask for the full proof of vaccination. So I think when you have the FDA approval of the vaccination, it's definitely a game changer for this country.
Oh, wow. Talking more about vaccine, now I want to focus on children because recently 12 to 15 years old have been approved for the Pfizer vaccine. And, there has been a big push on getting the children vaccinated of this country. How important is it for children to be vaccinated to reach herd immunity? And also, do you think we should only let children return back to school if they're vaccinated?
So children are mostly protected from getting this severe infection. So as long as about 50-60% of the kids in the college or the schools are vaccinated, and it's very unfortunate circumstance in this country that we cannot ask for the vaccination proof. If we do, I think it will be a good thing for our country. But my message to 12 to 15 years of age group is get the vaccination because you are as much risk right now as we were in January without the vaccination. So my message to those individuals 12 to 15, get the vaccine because your chances of getting infection is as good as in January.
And what about from 2 to 12, doctor? Right now we are hearing that there are trials going on already. My question to you is, do you think these vaccines could have an impact on the development of these children because they're at a critical age in that age bracket?
Definitely it's going to be impacted. However, I don't see that 2 to 12 age group vaccination will be ready before end of this year. Earlier, I was thinking that it may happen in August or September, but right now it's going very slowly and it may not get the emergency use authorization for between the age group of 2 to 12 before December or even January next year.
Right. When you're looking at the current healthcare system, I'd like to know where do you think it's lacking at this moment?
So lacking, like I said before, those vaccination reluctancy, those people who always oppose to take the vaccination naysayers, I think those are the people is going to be very challenging between now and end of summer. We need to reach that goal of getting those 60-70% people vaccinated. And if we don't reach there, winter may bring different kind of situation for this country.
Right. Do you think the government is doing a good job right now?
I think so. Government is doing a wonderful job getting people vaccinated, getting enough access to the vaccination to the local pharmacy and local clinics. Many health fairs is happening as well in the community. So government is doing their best, but I think those vaccine naysayers, I think we need to get them somehow strong message or some kind of incentive for people who received the vaccine,
Yeah.
and somehow we need to decide what we want to do with those people who don't take the vaccine.
Right, it's so important to get the vaccine. You know, it's life changing and it's life saving. Doctor, let's now talk about India because I have a couple of questions. My first question to you is, looking at the surge of the country right now, what is the impact on the rest of the world? And how can this surge impact us here living in the United States?
So the good news about India is the cases are going down, the hospitalizations are going down, the death rates are going down. So that's a very good news. However, a country like India, 1.4 billion people, to control the surroundings as well as the movement and have the restricted movement for the people, it's very challenging. So people comes from India all the time here. They may bring the virus in this country. We haven't seen any surge in this country from the variants from the Asian countries. So that's a good news. However, come winter months, it may be a little risky. Right now, India is doing well with the cases. So I hope they continue with that trend, and globally we may not have too much impact on new cases.
Right, and you know, just talking a little bit more about it, Doctor, and many are saying that the numbers that we're getting are a huge undercount, that the numbers could actually be 5 to 10 times worse. It's also spreading in rural India. Do you think enough cases are being counted right now? Are we sort of celebrating this victory too fast?
So that what happened in November 2020 also last year. From November to March this year, the number of cases counted were definitely miscalculated. The reporting were undercalculated. So I think those are challenges of infrastructure of India. And I think the actual number of cases and the number of deaths are definitely underreported. And if we do a good job of counting, and case count is very important in pandemic. If we don't have the enough good case count, then definitely they may see number 3 in their surge.
Right. The international media is blaming the Indian government for this crisis of COVID-19 in the nation by allowing the Kumbh Mela happen, by allowing election rallies happen. The country was open basically after January. What are your comments on that?
So definitely from November to March, the government, the administration, the healthcare system, entire healthcare system, including the medical providers, dropped the ball in getting the good information from the communities about the case count, the number of deaths, and all those big super spreader events happen in the country, which definitely lead to the biggest crisis of the century in India. And I think very unfortunate. And I know it's everybody wants to blame someone, but government is also responsible, and the people in India also responsible for those cases.
What is the biggest issue in the healthcare system there right now, Doctor?
So biggest issue in the healthcare system, as you know, I have worked in India for many years as well.
Right.
The infrastructure, healthcare, there is no healthcare infrastructure there. The resources are scarce. So in the rural areas, there are not enough doctors available. There are not enough healthcare centers available. Only in the urban areas, in the big cities, that they have medical facilities and the doctors available. So I think those are the biggest challenges. And about 60% people lives in the rural area in India. So you can imagine how system works there as far as the medical care.
It was already lacking. I don't think that they were ready for a surge like this. Do you think vaccinations are the answer? There's a huge shortage in India, even though they're producing AstraZeneca there. How are you looking at that? Will they be able to vaccinate as fast as they need to?
So the US, we are very fortunate that we reached about 50% people getting the vaccine. There are 8 billion people in this world. So if we count 70% people take issue vaccine, we need 11 million doses. It's a long way to go because right now we have only 1.7 billion doses produced so far and 1.2 billion administered. Some of the countries did not even reach 10% of the people getting the vaccine. So demand is very, very high, greater than the supplies. Vaccinating the countries, the developing countries are a huge challenge, and countries like India and other big countries will have a huge challenge because they did not even reach 10% of the population. So herd immunity there is going to be coming from the infection itself.
Oh, wow. What are your predictions for this devastation in India? How long is this going to continue for? And when would you see a huge change in the number of cases, according to you?
So right now, my calculation says by end of June, early July, they will start seeing number of cases go down significantly unless something big happens between now and then. By August, they should see the normalcy of life. The lockdown should end, and some new normal should happen back to normal in India.
So would the country open up, and do you think borders will open up internationally for India?
I think by end of July, early August, we should see that.
Right. Doctor, I would like for you to discuss with us, if possible. I know you have a lot of friends in India that are medical professionals. What is the current condition there for them and the hospitals? Like, are they doing okay? Do they have enough resources now? There was a huge shortage of oxygen, which we hear that there's still some shortage in certain parts of the country. How are you looking at that?
So most of the acute crisis has subsided now. They have the hospital beds, they have the oxygen, they have the supplies of PPEs. A lot of humanitarian efforts made by many other countries, including USA.
Right.
Many non-profit organizations from the USA help them. And most of the places now, I don't see. I stay in touch with my medical school friends almost on a daily basis, and I don't see those acute crises anymore. People are getting better and they are getting the resources they need right now.
What's the biggest piece of advice you can give to these doctors in India right now?
My advice is just follow the healthcare guidance, learn from what happened in the US and what happened there in April and May. And I think we all need to be vigilant. We all need to be careful because the pandemic is still here. It's not called off yet. When we see the number of cases go down to under 10,000 in the US, we can say that we are off the hook. But until that time, people in India and the US should take appropriate precautions to protect themselves and fight against this pandemic to end this pandemic soon.
Right. My last question to you, Doctor, is I'd actually like to get prediction for the United States for the next month or the next 2 months. What are you looking at? How it's going to look like?
For the United States, I would say next 2 months, at least 4 to 6 weeks, all vaccination, all eligible children 12 to 15 should get the vaccine as quickly as possible. Vaccination drive should happen at the schools, colleges, and universities. We still need to wear masks in indoor gatherings where we don't know who are vaccinated and who are not. My predictions between now and end of this summer is if we reach, and I think we will reach 10 to 15%. I think the last 5% of the population to get is going to be challenging. And that is where the government and the local municipalities and all the healthcare workers and the facilities should work to get those 5% people vaccinated after summer.